Hello, my name is Kelli Brien. I'm the president of MHAM, Mental Health Awareness of Michiana. I'm also a doula. I founded Mahogany Maternity, and I'm here today to talk to you about how to talk to your provider when you're struggling. The first and most important thing for you to understand is that everybody struggles. All parents struggle, and that is okay. It's new, it's different, and there's a lot to navigate. You're not alone. Understand that. The next thing that's important for you to understand is that you need to know your body. Be well acquainted with your health. Get your records, get your medical records from your provider, from the hospital, from your doctor. Review them and make sure they're correct. It's very important. The other thing that you should know are your rights. What are your rights in the birth room? What are your rights at home? What does it look like to be sure that your rights are being upheld and respected everywhere that you go, not just in the hospital, but everywhere that you go, right? So, the other part that's important is knowing your resources. Know that help is available. And so, those resources look like online, in person. There are places that you can reach out to. One such place is PSI, Postpartum Support International. This organization has a 24-hour helpline to speak with someone when you're struggling. And when you're struggling, the best way to speak with someone is honestly be open and transparent. There is no shame in asking for help. And the way to do that is to recognize what you're feeling. When you're feeling blue, when you're feeling sad or confused, it's important to stop, to step back, take a breath, and recognize what you're feeling, and then to ask for help. And what that looks like is calling your provider to say that it's really important to be seen as soon as possible because you are struggling, right? Ask for help and support from your partner, from your family, from those who are closest to you. And if you need them to go with you to your provider, that's absolutely okay as well. If you have the support of a birth or postpartum doula who is willing to accompany you, which most are, ask for accompaniment to your doctor's appointments and understand what you need when you're there. Write down questions and make sure you bring them with you. Keep a notebook by your bed. Sometimes that's when all of those questions and the confusion, when that comes out, you've got your notebook and your pen right beside you to write down what it is you're feeling, what you're needing, and bringing that with you to your doctor's office to discuss what you're feeling is incredibly important. One of the things that you're going to want to write on that notebook is this acronym, BRAIN, BRAIN. This is what you're going to ask your provider. What are the benefits? What are the risks? What are the alternatives? And you're thinking about what does your intuition tell you? And the N is for what if we say no or what if we do nothing? It's very important to ask those questions because that tells you whether or not your doctor is informed about what they're asking you. And if they're warm enough and they're open to asking, to hearing your questions and answering them with kindness and with patience. Know and understand that sometimes doctor's appointments can and will be cut short. So understand having your questions ahead of time and knowing that you're going to want to ask all the questions in the time that you have is important, and saying to your doctor, I really need to be heard right now. I'm not feeling okay and I really want support, right? And what does that support look like? So, having an open and honest conversation with your provider is important. Knowing that your provider is someone that you feel safe with. And if you don't feel safe with your provider, it's important to really express that. Share that with your partner, share that with your provider or a nurse or somebody that you trust. It's important to understand why you feel what you feel. Write down what you're feeling, journal that, and then make that a concise question, make that a concise ask of your provider, and make sure that if you're not getting the help that you need, you reach out again. Because there's always someone who has gone through what you've gone through, and there will be someone after you who goes through it as well. Stay in community. There are Facebook pages, there are communities online where you can get help. Postpartum Support International also has online support groups where you can go and be heard by a professional and a group of people who are going through the same things that you're going through. So, what I'm going to do is make sure that at the bottom of this production, you have these resources. MHAM also has a wonderful resource of pro bono counseling that is available to you. So there's someone that you can reach out to that can hear you and can help you. Know that you're not alone. Know that things do and can get better for you. And know that when you ask for help, you deserve that help. Don't be ashamed, don't be afraid, and don't wait. Thank you so much for your ear and your time. And please take care of yourself and take care of each other. Have a great one.